right, good afternoon and welcome to the IICRC Certified Firms webinar. I'm Angelina Dixon, Marketing Supervisor, stepping in for Gavin today. He's busy with certified firm renewals at the moment, but we have a very special webinar for you today and the next 2 months as they are about our newly published standards. It's a very exciting time for our standards department, our organization as a whole, and everyone who's involved. It isn't every day, every week, or even every month that a new standard is published. So it's a very special time. So here today we have a few very distinguished gentlemen who's worked very hard on the S410 standard to get it published and to tell you everything they know. But until then, I'd like to introduce to you Millie Washington, our standards director. Millie?
Thank you, Angelina, and hello and welcome to the webinar. Before we do a deep dive into the S410 standard, which is the topic of our discussion today, I want to just spend a few minutes just doing a general overview of IICRC standards, where we are, what's coming up next, what we have just published, things like that. So, just kind of going over some of the things that we are working on in IICRC standards. And so I want to just talk about three new standards that we have very recently published. The first is the ANSI IICRC S300 standard for professional upholstery cleaning. The last version of the standard was an IICRC standard, and so it's really quite wonderful to be able to publish an ANSI standard. And this is the second edition, but really the first edition of the standard as an American national standard. The second one that I want to touch on is the S900 standard for professional remediation of precursors, drug residues, and associated chemical waste. A first edition brand new standard. Both the 300 and the 900 were published in September. So these are really hot off the press. They're all available on our web store at this time, and we'll talk about that a little bit as I go along as well. And then the last one that I want to touch on, which we'll go into a little bit more on this webinar, is the S410 standard for professional cleaning of the built environment for infection prevention and control. This is our topic area for today's webinar, and our speakers, Graham Dick and Jim Gauthier, will get into that in just a few minutes. Also want to bring to your attention that we are currently accepting applications for revision consensus bodies for three of our existing standards: the S540 standard for trauma and crime scene cleanup, the S590 standard for HVAC assessment following fire, water, or mold damage events, and then the S800 standard for professional inspection of textile floor coverings. We are accepting applications for all three consensus body through the end of this month, October 2025. I will make sure that we put a link in the Q&A so you have that for the application forms. They are online application forms. If you were on a consensus body during the last revision, you still would have to apply. So I'm just making sure that that is clarified. If you have an interest in any of these standards, please do apply. We would love to see an application come through from you. The next topic that I want to just touch on is our standard subscriptions. I'm hoping that most, if not all of you here who are attending the webinar already are subscribers to the IICRC standards subscription. It is really our best value product, gives you access to all of the standards online through a subscription. What's changed, what's new is that we have been able to bring back the organizational subscription, which allows your organization to purchase multiple subscriptions and allocate access to multiple employees within the organization. You are also able to change that access depending on turnover or changes within your staff. And so that is something that we did not have for the last few years. I'm really happy to say that that's back. And in addition to that, we also have the inspection bundle subscription. So if you're only interested in our inspection standards, you can purchase a smaller bundle as well, same as for the restoration bundle subscription and the cleaning bundle subscription. So if you are not using all the standards, you have the ability now to purchase and have a subscription to either inspection, restoration, or cleaning standards. And as new standards get published, they're made available automatically on your subscription. You don't pay anything extra for it. So, just a great value. I just wanted to make sure that we share that new bit of information. And you have the link there. It is available through the IICRC standards web store, either an individual subscription option or the organizational subscription option. We also have volume discounts available. So I think that might, be helpful. And since I am now presenting or sharing my screen, what I'm going to do is I'm going to have Graham, our presenter, and Gauthier, co-presenter, introduce themselves, if you don't mind, Graham and Jim, and then they will take it away with the rest of the webinar. And please let me know when I need to advance the slide, and I'll do that.
All right.
Graham?
I thought you were going to introduce me, Millie, but that's fine. My name's Graham Dick, and I am the owner and I guess um, big kahuna at Genesis Restorations. We are primarily involved in working in acute care hospitals across the Greater Vancouver region in BC, Canada, and pertinent to this standard, we just yesterday finished a cleaning and disinfecting of a brand new 800,000 square foot hospital in Vancouver, and so that was quite a cleaning job for my team, and we used a lot of the processes and principles that you find in this 410 standard. So very excited about this release and talking about that today, and look forward to your questions.
And
Thank
I'm
you, Graham. Jim, if you can go next, please. Thank you.
sure. Millie, could I just ask a quick favor? Could you go up to the top left and swap displays? We're just seeing your speaker notes, and
Oh,
that should put it into a full view here.
yeah, absolutely. Go ahead, and I'm going to see how I can figure that out.
Okay. While you're doing that, I'm Jim Gauthier. I'm an infection control consultant. I've worked over 40 years in healthcare. I've got a background in medical laboratory technology, so I love all my microorganisms. That's great, Billy. And I've also worked in infection prevention and control in almost anywhere where there's a risk of disease transmission. So I've done it in acute care, non-acute care hospitals. I've consulted to long-term care, funeral homes, dentist office, medical offices, pretty much anywhere, again, where there's a risk, you can find it. And the last 8 years of my career, I spent working with Diversey, a company that sells cleaning and disinfecting products, but I was their educator. So that was my job, best job in the world. I've been semi-retired for a couple of years now, but still doing things like this and helping other people with their infection control concerns. So if we go to the next slide, I'll turn this back over to Graham.
Right on. Well, the consensus body is really the team that stuck it out from the start to the finish. I'm not going to read everybody's names. There was in this group and as well, we had contributors that we tapped into their knowledge, their experience, and it really was an amazing collaboration. Um, it was very humbling to work with so many highly educated people, and we had people from CDC involved. Some names that some of you might recognize from the cleaning world are Dr. Jean Cole, who's been around for decades and retired during the writing of the standard, but he was good enough to collaborate and review and provide feedback as things were being drafted. We have just several other people, Dr. Greg Whiteley from Australia, um, Stefan Wagner from Global Risk Advisory Committee, Paul Meechan from CDC. We had some great inputs from several people, and it was critical to the success of this document. So, yeah, next slide. Next slide. Who's controlling it? Millie? There we go. Why the standard? So going back to the pandemic and as everyone saw during the pandemic, anyone that could buy a sprayer and some kill juice suddenly became a viral decontamination expert. And and there was just an awful lot of COVID theater, we call it, where people assumed disinfectants worked, uh, but hardly anybody actually read the master label and applied them according to manufacturer's instructions for use. Uh, Awful lot of assumptions, not very much disinfecting was actually taking place. Cleaning actually suffered because people thought that disinfectants were doing all the work. And it was the Wild West. And even though there was a lot of good intention, we believe, uh, it it was largely misinformed and a lot of poor practice was going on. And it was in that context that the 410 was born and started. At first, we were scrambling, going, "Can we finish this in time to be of service to everyone during the pandemic?" And it became clear that in order to really do this job properly, we needed to put in the time, and it just wasn't going to happen. Thankfully, the pandemic ended much sooner than we were able to deliver our standard. So certainly moving forward, we can do a better job and be much better prepared should that ever happen again. Lessons from COVID theater, really, it was nuts out there. Um, Many of you may have been involved in cleaning and disinfecting practices. We saw in the news, people going around with ultra low volume foggers or electrostatic sprayers. We had lots of people claiming the world, and everybody's kill juice was the silver bullet. It was really something. So one of the things about this standard is a real strong emphasis on proper disinfectant use. Really looking forward to Jim laying that out as we move on in this presentation. I've always been about don't make assumptions. Can you prove that anything happened? I've always said as a restorer doing sewer backups that if I was an insurance company, I wouldn't pay a restoration company for applying disinfectant. It doesn't take brains or skill to apply disinfectant. It takes skill, experience, and training to actually have a measurable, verifiable outcome. And so this standard is all about following a process that gives a highly increased confidence for that verifiable outcome and being able to pass any sort of testing or quality control criteria that your client may throw at you. Next slide. The S400 recently was completed as well and released. It's a commercial cleaning standard, and as a cleaning document, it kind of sets the baseline for cleaning in homes, schools, and community commercial spaces. But the 410 takes it one step further, and I'm going to read from the forward in the standard so that you have a bit of an idea of where the standard is intended for use. So the 410 is a procedural standard. It was conceived in response to a critical gap in existing cleaning and disinfection guidelines outside of licensed healthcare and agricultural facilities. It provides guidance on enhancing routine cleaning practices with infection control measures designed to reduce exposure risks to pathogens and improve public confidence in cleaning outcomes. The standard is for cleaning, sanitizing, disinfecting, evaluating, and maintaining indoor spaces to achieve hygienically clean outcomes that are measurable and verifiable. And that last sentence is really the foundation or the cornerstone of the 410. It's about an outcome that's measurable and verifiable. Next slide. Scope and application. Jim, were you addressing that?
Yep. So Graham has set this up quite nicely. The scope of the document is actually very important to understand. The S410 discusses cleaning and disinfection for biosafety risk groups 1 and 2 organisms. So even with my microbiology background, I had to go to our definition section of the document. A biosafety risk group 1 has no or low individual and community risk. So it's a microorganism that's unlikely to cause human disease or animal disease, because we are surrounded by microorganisms all the time, anywhere on the planet Earth. A biosafety risk group 2 has moderate individual risk and low community risk. So it's a pathogen that can cause human or animal disease, but is unlikely to be a serious hazard to trained workers such as laboratory workers or out in the community or livestock or the environment. This document is not talking about the risk group 3 and 4 that are covered in the definitions section. So I want to stress again where the S410 does not apply. It does not apply to healthcare, which has many accrediting bodies, regulatory agencies, and guidelines to handle everything that we do within a healthcare setting. It does not apply to laboratories or to hazardous substances, and we'll cover that a little bit later in terms of what we have to look at in terms of waste management. So users of the 410 are listed on the slide here. That is for technicians, operations, facility managers, and regulators or inspectors. So I'll turn this, can we go to the next slide? And I'll turn this back to Graham.
Right. I wish I could ask a question and see a show of hands as to how many of you are familiar with IICRC standards and therefore understand the trigger words. Since I can't, I'll do a quick review. Shall is mandatory, and really what we look for when we're looking at applying that trigger word is it a regulation? Is this a requirement of a government agency such as WorkSafe, workers' compensation, OHS regulations? Is this a requirement of some regulatory body that oversees our jurisdiction that we're working in? That's one factor. The other is natural law, and where that applies is physics. For example, when we get to disinfection and we talk about that, droplet size is a thing, and using a sprayer that delivers a certain droplet size, if it delivers a small droplet size, for example, and your disinfectant of choice requires a lengthy dwell time, it may not stay wet long enough to achieve the manufacturer's kill claims. So just by physics, that becomes a shall type of function. Should is a requirement when complying with the standard of care. So anytime you see should in a IICRC standard, it's part of following the standard. It's not optional, and so you need to kind of incorporate that into your standard operating procedures or safe work procedures. Recommended is advisory. It's not a component of the standard of care, but it is an option that can be considered. It could be something that would turn your work practice into a best practice, perhaps, but it's not something that in order to meet the standard of care, you have to do. We think it's important. We think it's a good idea. And when it comes to something that's recommended, one way to think about it is if you didn't do it, you should have thought it through and have a reason why it wasn't appropriate, not just automatically delete it. Is there a good reason why I'm not doing it on this job? Because it is recommended. So that's how recommended used in this standard and in all IICRC standards. Next slide.
So these are the sections that are that Graham and I are going to cover fairly high level to allow you to see, and you can ask questions if you want some more detail. We've already discussed the scope, purpose, and application. And as I stated, there's an extensive definitions section. So section 1, we're going to talk about cleaning principles. I'll handle some of that and the waste management in section 2. Section 3 is about equipment, tools, and supplies, the proper use and handling of them. Section 4, antimicrobial agent product selection and use. Section 5, training requirements. Next slide, please. Section 6 is safety and health. Section 7, communications. Section 8, administrative procedures, project documentation, and risk management. Section 9, inspection preliminary determination. Section 10 are LCCC, or limitations, complexities, complications, and conflicts. Section 11 is quality assurance management, and then we're into our references at the end. Next slide, please. So section 1, I'm going to talk about here, it covers the various types of cleaning principles, from routine cleaning to specialized infection control cleaning. And I'm sure you're all familiar. Cleaning by itself is just the physical removal of foreign material from surfaces and objects. So this step should always precede sanitizing or disinfecting steps. There is a statement in the S410 on routine cleaning, and it defines it as a process that has been merged with infection prevention practices and measures to optimize the safety and mitigate the risk of spreading, transmitting, and acquiring an infection or an infectious disease. This is the normal, common area cleaning that cleaning operations and technicians should be familiar with. Enhanced cleaning, the document gets into it, is implemented where there are health alerts, either within the facility or the community. Examples would be an increase in like viral respiratory illnesses that we went through in 2020 with COVID, or a high amount of RSV or influenza, or an increase in vomiting and diarrhea caused by norovirus, for instance, in an area. Then we use proactive steps to reduce the risk of an infectious outbreak. We may implement more personal protective equipment, or PPE. We may increase the frequency of cleaning. We then may also introduce the use of a disinfectant along with the cleaner. We want to prioritize high-touch surfaces, such as counters, door handles, stair rails, elevator buttons, etc. There may be issues where a specialty service contractor would be brought in if the cleaning operation that's looking at this document is not comfortable with the enhanced level. Crisis or outbreak cleaning is where we're looking at cleaning that is triggered when the relevant public health authority, for instance, when U.S. Public Health Services, CDC, the Public Health Agency of Canada, or the local public health office declares an outbreak. We experienced this in 2020 with COVID showing up. The S410 uses the shall statement here, and I quote, "Cleaning operations shall work in collaboration with and follow directions established by the health authority to address the outbreak appropriately when required." So depending on the infectious agent, HEPA filtration of equipment or air scrubbers may also be indicated, and we cover that in the document. For each of these steps, cleaning principles are required, which involve identifying the soil or doing a pre-inspection process, the removal of the soil, containment of the soil, disposal of the soil, and a post-inspection process that we will also discuss in terms of verifying that we've done it correctly. Next slide, please. So section 2 on waste management provides information on how to use the infection prevention and control practices to manage waste that is generated or collected by the cleaning companies. So the classification of general waste can vary by the authority having jurisdiction. State or provincial recommendations for waste may be different from municipal, for instance. The cleaning operation needs to understand how their own equipment, tools, and supplies, or the ETS that Graham will talk about, need to be handled. For the waste classification, general unregulated waste is any waste that does not fall under recycling or a specialty regulated waste category, such as items not heavily contaminated with blood or body fluids. This is where the authority having jurisdiction can vary on waste separation and recycling. Cleaning operations should check with both the facility point of contact for policy and the authorities having jurisdiction for appropriate rules, because this may change depending on where you are. Regulated waste or specialty waste includes things like biohazardous or medical waste, hazardous waste such as asbestos, lead, or PCBs, sharp chemicals such as cleaners, solvents, disinfectants, pesticides, fertilizers, pharmaceuticals, and all the handling needs to be compliant with the authority having jurisdiction. The S410 then outlines the handling, transport, and disposal for both general waste and regulated waste, describing parameters that must be met. If the cleaning operation does not meet all requirements, to handle regulated waste, compliance companies shall be used, including using waste containers or systems provided by the compliance company. If we go to the next slide, Graham will continue on.
Right on. Equipment, tools, and supplies, in short, ETS is how we refer to it in the document. We took a novel approach. So often, documents refer to equipment and tools and more discuss how they're used or what they're used for. The approach that we took in the 410 is to look at those tools and equipment and go, how are these used to capture, remove, kill, or inactivate the known or suspected microorganisms? How can cross-contamination occur through the use and or storage of that equipment and tools? Do we put that equipment away dirty? Do we clean it? Should we rinse it? So often the wheels are tracking, and then we track soil and contaminants from one room to another or from one area to another. What about vacuum exhausts? What kind of vacuums are you using? And how efficient is that vacuum? Are you picking up the chunks and blowing the little stuff back into the air where it then circulates and resettles? How many times have you turned on a vacuum cleaner to smell that musty odor that emits from a vacuum? And what you're smelling is contamination. You're smelling mold. You're smelling all kinds of stuff coming out of the vacuum that should be kept in the vacuum. What that tells me is either it's not HEPA or it's not hasn't been certified in quite a while, and there is a leak where the air is bypassing the HEPA filtration. How does the cleaning process spread contaminants from one surface to another? Sometimes that's a work procedure. Sometimes that's a technique in how you're wiping or how you are mopping. One of the things that we're pretty clear about is mops. For example, string mops were invented several hundred years ago, and it's probably time to let them retire. There really is no legitimate way to decontaminate them or clean them after use, and most of the time people are using them incorrectly anyways. After doing water damage in hospitals for the last couple of decades, I can say that almost every time I've removed vinyl cove base after a water escape, I find pre-existing mold. And I came to the point where it's like, okay, this is mop mold. It's from overly wet mopping practices. And it just is so difficult for string mops to be used in a manner that doesn't create that problem. So that's just another example of how our cleaning processes can create or cause contamination. And those are the things that we want to consider. Are we taking things off the floor, off the surface, and stirring them up into the air where people are then at risk breathing them, both the workers and or occupants? And so from a standpoint of equipment, tools, and supplies, we took quite a different approach and go through it. Sprayers, I alluded to this earlier. Sprayers should be matched to the type of disinfectant that you're using. And what are you trying to accomplish? So when applying a product, the most important thing, and Jim will hit this with disinfectants and antimicrobial use, but there's a specific dwell time that you have to achieve in order to get that manufacturer's kill claims. If you're using the wrong type of sprayer, you just can't get there from here. And this was a major problem during the pandemic, where people were using sprayers that were not matched to the disinfectant. For example, using an electrostatic or a low volume fogger to apply a disinfectant that had a 10-minute contact time required. You just couldn't get there. Nobody actually disinfected anything when they did that type of process. So we have a section on sprayers, different types of sprayers, the pros and cons, and applications where it's appropriate. Same thing with vacuuming. Vacuuming is so important. And again, is your vacuum picking up the big pieces and throwing the small pieces, the stuff that stays in the air and hangs in the air where people can breathe it, where it can create a health risk? Is that something that you've considered? And how many times I've inspected a vacuum where it was actually missing a bag or missing a filter, and certainly not being maintained to even the manufacturer's specifications. One of the things to consider is wet vacuum exhaust, and if that waste tank isn't being cleaned and rinsed after every use, bacteria grow very quickly, and as soon as you turn the vacuum on, you're puking bacteria into the air, where then it spreads and contaminates the environment that you're in. So what are you doing with your wet extraction equipment? And those are considerations. By the standard, there's lots more. Jim.
I guess that's the next slide then. So I'm going to talk about these bullets here. This is section 4. I think most of you would be aware that most antimicrobial agents are regulated through federal agencies such as the EPA, or the Environmental Protection Agency, which is a part of the Food and Drug Administration. Health Canada here, where I sit in Canada and Graham sits in Canada, regulates our antimicrobial agents. And in Europe, the European Committee for Standardization, or the CEN, regulates antimicrobial products. So as I previously mentioned, cleaning should always be carried out before disinfection to remove visible soil or organic material, because that can inactivate your disinfectant. Even with a one-step cleaner disinfectant that has been tested in the presence of soil, it's only tested in the presence of 5% soil. So when I used to lecture on how to use a wipe, I would always describe that if you wipe a surface with a one-step disinfectant, cleaner disinfectant, and you can see dirt in the shape of your handprint on the cleaning cloth, the surface was dirty, you have cleaned it, and now a new cloth needs to be used to disinfect, even with a one-step cleaner disinfectant. The disinfectant product selection needs to meet the cleaning operations requirements. This would involve a general knowledge of the infectious agent in the environment. Many disinfectants are not effective against things like rhinovirus and norovirus, or the winter vomiting disease, as it's also called, or stomach flu, which I don't use the term. But those two viruses, rhinovirus, which probably causes upwards of 80% of our head colds, and norovirus, are both hard to kill viruses. They are not the cold and flu viruses, things like influenza and COVID and RSV and other cold viruses that are actually quite easy to kill. Store-bought disinfectants will not kill those hard-to-kill viruses like norovirus and rhinovirus. The disinfectant product use is outlined in the document. The primary statement is that the user shall follow the disinfectant product label instructions. When I worked for Diversey, we always said the label is the law. You have to follow what is on the label of your product. So that outlines the concentration. If it's a dilutable, the application methods, such as can you use it through a pump sprayer, a trigger sprayer, or even an electrostatic sprayer. And it also lists the wet contact time to achieve the kill of the microorganisms on the label. So as I just mentioned, if a dilution control system is used, these devices should be calibrated and tested. The document indicates testing at least when a new bottle of concentrate is added to the unit, and at least weekly to confirm dilution accuracy. There are several common issues that can be investigated if the dilution is not what is expected, such as checking the water pressure to the station. It may be too high or too low, or the water pressure may fluctuate depending on if there's other equipment on that water line, such as a dishwasher or a laundry machine. You also want to make sure that the water quality is what is specified in the concentrates instructions for use, and you may end up with things like plugged tips or jets. Disinfectant devices are briefly mentioned in the chapter. That would be adjunct or add-on technology such as UVC, machines, and ionizer or electrolytic units. So we have some comments there. Residual efficacy products are also reviewed in the document, and it is noted that these need to be used in conjunction with the cleaning and disinfection, and that using the products does not reduce the need or frequency of routine cleaning. We have very clear language that cleaning operations should not state that a disinfectant, a sanitizer, or a fungicide has any ongoing or further residual efficacy unless it has been registered with the regulatory bodies to prove that these claims are there. Okay, so I'll turn this back over to Graham to talk about how we train and what the training requirements are.
Yeah, training roles and responsibilities, topics, audits, and record keeping. So often in the cleaning industry, and it's similar to painting. There are high levels of certification in painting, but it also is one of the lowest barriers to entry. Go to Home Depot, buy a paintbrush, buy a bucket of paint, and you're a painter. Uh, and and so you have everything in between. In cleaning, it's very similar, very low barrier to entry. Anyone can buy some cleaning solutions, a rag and a mop and a vacuum, and they're in the cleaning business. But there's so much more, so much more. And there is a lot of education to bring someone up to speed on the chemistry of cleaning, on the biology of contaminant removal, on the physics of cleaning. I often say it's an amazing collaboration of science where I wish I'd paid more attention in high school. And since then, I have to admit, a lot of the IICRC training classes that I've taken over the years have helped tremendously in improving my cleaning knowledge and making me a better cleaner. Training systems and programs in your company make all the difference. And it's not about assuming that someone knows anything. How to fold a cleaning rag, how to hold it, how to wipe a table. One only has to watch the average server in a restaurant wipe tables, and you see all the different techniques that people use, and virtually all of them are wrong. And so we go into that in some detail in this document. When it comes to having a verifiable result, a big part of it is documenting how you get there. And it's kind of like, remember math class where the teacher didn't want to just see the answer, they wanted to see how you got to the answer. And when it comes to getting a verifiable result, we don't want to just see a clean surface. We want to understand, how did you get there? Because the process does matter. And keeping good records is a big deal. Next slide. PPE. Let's see, that's me as well. PPE, when it comes to your basic cleaning, as with anything, there always should be a hazard assessment. What hazards are present? A risk assessment. What is the risk of that hazard affecting you as the cleaner? And then following the hierarchy of controls, what engineering controls are appropriate, and working your way down to PPE, personal protective equipment. That's the last step in safety, not the first step. And so from your typical PPE, what needs to change when you know that you're dealing with biological contamination or suspected pathogens? Well, it's a matter of what's the risk. Is this a contact germ, or is this a airborne germ? We didn't know at the beginning of the pandemic what it was, so we started off with universal precautions. And when you're following universal precautions, you go, okay, well, it could be a contact risk, it could be a airborne risk, and so you protect yourself both ways, which means that you have good gloves, good respiratory protection, and those types of things. So the standard addresses that and directs you towards the thought process, so that you include that, and then how do you document that and that out in your company with your cleaning staff. Um, Next, Jim.
I get to talk about Section 7 here on communications. This section addresses the development of your communication strategy and your approaches, including written and verbal, informal and formal communication. We recommend an up-to-date registry of applicable laws, regulations, and guidelines regarding specific communication requirements that should be maintained, along with a communication plan and a method for informing employees of their roles and responsibilities. The communication strategy development preparation phase is used to assess the current communication status and what are future needs. This assessment will help support organizational visions and business goals, delivering current and up-to-date information to customers and stakeholders, and allow for comprehensive, clear, and consistent messaging. The S410 will help with this communication plan development, providing point forms on roles and responsibilities of leadership and your audience, what to communicate, how to communicate, and when to communicate. This section provides basic information and a framework to develop your communications plan that will meet differing company needs. Graham, do you want to discuss the next slide on administrative procedures?
Yes. This is where if we were all together, I would again ask for a show of hands. How many of you are cleaning technicians, and how many of you are managers or employers that employ cleaning crews and technicians? When we wrote the standard, we really wrote it with both groups in mind, from a cleaning operation owner all the way to the cleaner. And so some aspects of the document of the standard apply more directly to the person on the end of the equipment, tools, and supplies. Others more towards the risk management, the contract, the communication, dealing with the insurance. And one of the things that we've seen over the years is that people often assume, take insurance as an example, that just having a commercial general liability insurance policy is enough. And I want to tell you it's not. You need to talk to your insurance broker about things like a pollution liability insurance coverage, because your CGL excludes risks where you cause contamination or cause cross contamination, something that affects someone else's health. If someone takes a run at you, your CGL policy isn't going to come to your defense. You need a special pollution liability enhancement for that. So that's one example for the insurance. I always say, as contractors, the only reason a contractor gets screwed is because their contract was weak. And so we've provided kind of a checklist and and a lot of points on project documentation, record retention, risk management, uh, product safety management to help you with pulling together how to produce the best chance of success for your company, not from a cleaning outcome standpoint, but from a business outcome standpoint. We want you to succeed. We want you to be profitable. We want you to get paid for the work that you do. And so it's not just enough to be a good cleaner and then hope that they pay your bill. You need to have good contracts, and that's where the communication uh, systems that Jim was referencing and our communication chapter coordinates with the administrative sections as well to help you be successful. Jim.
Thanks, Graham. So next up is the chapter I really liked. We've all worked on this, and we had a lovely flow chart drawn up on inspection and preliminary determination. So we need to know what kind of cleaning we have to do. So if you can answer yes to the steps that are listed here, if you go in and it's a trauma or a crime scene, you should be using the S540, not the S410 that we're talking about here today. If you can answer no to all of these, it's not a trauma scene, it's not water damage, there's no visible mold, there's no visible blood, there's no visible drugs, then you go back to the document, the S400. That's not being discussed here, but we mentioned at the start that it exists because it's the standard for professional cleaning, maintenance, and restoration of the commercial built environment. So I like this flow chart. It helps you figure out exactly where and how and what you should be following in terms of a routine. Graham, can you discuss section 10 for us?
Yeah, limitations, complexities, complications, and conflicts. Again, if you are familiar with IICRC standards, this is a section in every standard, but what we try to do is to make it specific to the subject matter of that standard. And so, for example, a limitation, okay, and I'll maybe just go over and review what they are again. A limitation is a restriction placed on you by a materially interested party, and it results in a limitation on the scope of the cleaning activities. It could include means or methods and the results of the expected outcome. Limitations should be identified before you start and acknowledged in writing. That's again where we were talking about the contract. What's your scope? What are the expectations? Where are you limited? And then complexities. Again, for the purpose of the standard, a complexity is any condition that causes the project or job to become increasingly difficult or detailed, possibly causing a delay, without preventing the scope objectives from being met completely. So complexities should be recognized and acknowledged also before starting any work. But sometimes you don't know until you start to peel the onion. And you discover things after you've started the work, and it's like okay, this is going to blow my time schedule. This is going to blow my budget on this. There's something that causes, and that's what the next thing is, a complication. Something that comes up after the job starts, and it's going to affect the job, whether it's the outcome or whether it's flow or schedule. And those are things where communication and timely communication is so critical. A conflict, well, we all kind of know what conflict are. There's opposing opinions between the materially interested parties. You're working for a facility manager or a property manager at a site, and they think that you should. Oh, well, this is easy. You should be able to do that, and it shouldn't take you any time at all. And well, that's you have a difference of opinion. That's actually going to add an extra 8 hours to this project, and it's going to cost me this and this, and I actually need other supplies in order to accomplish that. Whatever the case may be, you got a conflict, and this is where we provide a bit of a framework for you to work through that conflict. Also, inside of that section 10, we go into greater depth on insurance. I hit on it briefly in the last slide. We go into it in a fair bit more depth. Really, the purpose there is for you to be able to cut and paste that into your email to your insurance broker and say, hey, I need you to consider this from your professional perspective on how to help me manage risk in my business. And let's do an analysis of my needs, taking these points into consideration. Change orders, we discussed that. Work stoppage, depending on the site, depending on the job, that can be a big deal or not a big deal. And yet when those things happen, the biggest reason why contractors don't get paid is because it was so poorly documented. It was just verbal. And you think you can work on a handshake deal, and some people have gotten away with it for years. But at the end of the day, if it isn't documented, it didn't happen. I kept that on my whiteboard in my office for years, and I repeated that. My guys knew that was my mantra. If it isn't documented, it didn't happen. So that is section 10. Quality assurance management, section 11. This was a really fun chapter to develop, a fun section, because quality assurance, quality control is how do we improve the outcome? How do we manage quality to get better outcomes? What components make a good quality assurance program that is going to improve the quality that your company puts out and is consistent, has a consistent outcome. How do you audit? And so we also go through several different methods of quality control. One being observational coaching, and that's where you watch someone. People tend to perform better when they're being watched, don't they? And so some people think, well, gee, what's the point of watching somebody if they're just going to work harder while you're watching them? Well, let me tell you, because they're going to try and do their best when they know they're being watched, if you watch them and they're doing it wrong, it's not their fault. It's your fault. They have inadequate knowledge, inadequate training. They haven't learned the technique. They don't know how to deliver your expectations. And so the benefit of quality of observational coaching is that you get to see whether the people actually know what they're doing. Because if there's any time when they're going to do what they know how to do, it's then when you're watching them. So that's just one example. We go through enhanced visual and odor inspection, fluorescent markers, ATP. There's quite a thorough section on ATP. It's a fantastic technology, but there are definite pros and cons or limitations to what it can tell you and what it can do. And a lot of people use ATP testing incorrectly and then make incorrect statements or claims about what it did. ATP testing does not prove a surface is disinfected. It does not identify the type of cell that, whether it's bacterial, human, animal, or fungal cell, it just says there are cells on the surface. It doesn't identify viral matter on a surface. And ATP test swabs can be affected by various cleaning chemicals and various disinfectants, leading to false positives or false negatives. And so, unless you're really following the correct processes with everything, ATP testing can be a fantastic tool, but used incorrectly, it's still not telling you what you think it is. It can be misused fairly easily, and so we provide a fair bit of information in that respect. Culture sampling is the highest level. That's where you're taking swabs and sending them to the lab for analysis. That's unusual, frankly. Most clients are unwilling to pay for that and don't require that level of verification. But frankly, that could happen. And depending on the circumstance, are you prepared and are you confident that if they bring in a third party inspection service to take swabs from your cleaning project, then are you going to pass? Do you have a confident that your system is working? That is kind of the end of our presentation. Looking ahead, the reality is that as a standard, all standards are living documents, and they will be updated as every 5 years is how it is with an ANSI standard, and IICRC tries to match that as best as possible to keep their standards in line with ANSI. That means that the next consensus body that works on this document will look at current science, studies, what's changed, what's new. Is there something that was just kind of starting to come to the market that now is mainstream and is being used as a standard of care in the industry? And so everything keeps improving, and changes will be adopted and integrated. So back to you, Millie, I think, and we'll take questions.
Thank you, Graham. Thank you, Jim. I think back to Angelina. Go ahead, Angelina.
All right. Well, thank you so much, gentlemen. That was a lovely presentation. 410 is actually one of my favorite standards because I love cleaning and love learning all about disease management and infection control and so forth, along with the S540, but everyone loves the S540, right? Everyone loves crime and believe it or not, crime scene cleanup. But we have one question here. I also have a question, but I'll read their question first. It's from an anonymous attendee. Inspection and preliminary determination flowchart. Is there water damage, black gray water? That's the first question. If Graham or Jim will answer that.
I believe the question goes on, Angelina.
Oh, that was their second question. Does this mean that this document would be appropriate for water damage cleaning? That would be category 1.
This document is going to improve your cleaning outcome for anyone that cleans that wants a verifiable outcome. And that goes across the board. There's nuances when you're dealing with the initial gross removal in black or gray water in the S500, but when it comes down to the final steps and going, okay, is the standard cleaning after I've removed the black or gray water going to suffice, or do I need a disinfected result, a surface that is hygienically clean, and do I want to be able to give my client a higher level of confidence in that, not just say, hey, we were very liberal with the disinfectant. We soaked everything down with disinfectant. Trust me, it had to work. It had to work. You know, it's what we always do. We don't get any complaints. Trust me. Right. So yes, the 410 will improve your outcome.
My question is actually, Graham, you mentioned about vacuums and that have, vacuums having like moldy smells, I guess burning kind of moldy smells due to maybe a leak in the HEPA filter. I think I've witnessed that a time or two, but is there a way to prevent that? Do you get a new vacuum? Do you get a new filter? What's your recommendation?
Vacuuming. Are you? Would your question be more relevant to like residential use or
Residential.
commercial?
Mhm.
Residential. Ideally, your vacuum would be a built-in, and the exhaust doesn't exhaust inside your garage, but it exhausts outside, so it doesn't re-entrain into the house. When you exhaust into a garage, that re-entrains quickly into the house. So any fine particulate comes back into the house very quickly. The way I explain that is if someone goes and lights up a cigar in your garage, how quickly do you smell it in the far reaches of your house? Almost instantly. So it is with the vacuum exhaust. Anything that's coming out of that exhaust is back in your house almost instantly. So that's how built-ins work. With the rest of your vacuums, it comes down to making sure that they're clean, that your bag is that you have a bag or a collector that's effective, and that the filter is fitting, that it's not that it's sealing properly. You want all the air going through the bag, through the filter, in order to give you the best result. Usually, I would say most vacuums these days are going to give you a pretty decent result, as long as they're maintained and working to manufacturer's spec. If you want better, then you have to go to HEPA. And just because it has a HEPA filter doesn't mean that it's certified HEPA. What that means is that it's been performance leak tested to prove that all the air flowing through it passes through the filter.
Okay. Well, there you have it about vacuum. So
All
if
I
you're
can
planning
say
to
about
clean
that.
this weekend, then that's all the good information there. Does anyone else have any more questions? Oh, did we get? Yeah, we got a new one. From Robert here. Do we get any CEC credits for this session? Yes, you do. I believe it's one. Gavin might correct me, but I believe it is one CEC, and he'll be tending to those after the webinar. But is there any other questions about the presentation or about the S410 or standards in general? We have Millie here that can answer pretty much anything in terms of standards. Will you be sharing the recording? Yes, we will. We'll be sharing it with everyone who attended and everyone who weren't able to make it. Okay. And Brandon Adams says, not a question, but good to see you all. So hello to Brandon. Okay. Well, I don't think we have any more questions here, guys. But do any of you have anything else to add before we take off for the day?
Oh, just a big thank you to Graham and Jim.
And Millie, do you want to preview maybe to the next webinar for next month?
Absolutely. Another standard, we will be covering the S900 standard, same time, same place, third Thursday of November at the same time. So please register for it. It'll be a similar format with information on the new ANSI IICRC S900 standard.
Sounds good, guys. Well, thank you very much. Thank you for attending today, and we will catch you next time. November 20th is our next webinar, and we'll see you then. Thank you so much, guys. Have a good day.
Thanks, everyone.